So first of all, good afternoon from London. My name is Simcha Yong. I'm the Professor of Management and Healthcare Innovation at the UCL Global Business School for Health. And more importantly, for the purposes of today's presentation, I'm the Director of the DBA Health program at the UCL Global Business School for Health. So first of all, thank you for your interest in this program. I prepared some slides to tell you a little bit more about this program. And afterwards, there will be plenty of time left to offer you the opportunity to have some, to pose some questions, and we can have a discussion about anything you wish. So let's get started. I'll get my slides ready. And yeah, so this is a presentation of the UCL Doctorate in Business Administration for Health. And so I will talk a little bit more first before I talk about the program, about our school. We're really the UCL Global Business School for Health. We're really the first business school in the world dedicated to health and educating the next generation of health and healthcare management leaders. We are the first. There are others who are considering following our example. But for the moment, we're the only ones, and our mission is really to reimagine healthcare management on a global scale. So our aim is really to unravel understand better, do research on the health challenges from a business perspective. And we question the status quo in healthcare management to inspire the public good. So the idea is really to, yes, we study health and healthcare from a business perspective, but yeah, the overall aim is to improve healthcare and health from a social public good perspective. So why this program, and why consider enrolling in this DBA for Health program? So the aim of this program, the ultimate goal is to educate, train tomorrow's thought leaders in the health and healthcare space. And what we, in order to achieve this, what you will gain in this program, it's the necessary research skills to address these health sector challenges and to develop this thought leadership. So the idea is really to help students to reach new heights in their career in the field of healthcare management, industry, health services, consultancy, policy, and to support you in your personal and professional development. So it's really about building self-confidence as a thought leader and to accelerate your career. So research at our school, at the UCL Global Business School for Health, is highly varied. So it's what makes our school unique. We're a very interdisciplinary school. We're based on the new UCL East Campus, embedded within the Faculty of Population Health. But we really are embedded in, we have collaborations, ties across the entire UCL Health research landscape. And as a result, the research that we are conducting, the research that you'll be working on as a DBA student, can be highly varied. It can range from research with an international dimension, focusing on hospital or social care. It can be based on sort of secondary. You can relying on secondary data, doing field work. It can be an applied or theoretical piece of research that you'll be working on. And you can either collect your own data, or you can decide to collaborate with one of the many faculty members who are working at our school and have their own data sets. And so what you will gain is access to this academic expertise, these networks that that we have here within the School of Health, as well as from across the faculty of population health sciences and the entire sort of innovation health ecosystem that we have here in London, in which UCL is really quite centrally located. So some of the highlights of this program. So this program is really designed for students who have a full-time job, who do this on the side. They don't want to do a doctorate program on the side. So it's really designed to provide the flexibility for professionals who are studying whilst working full-time as a senior health leader or manager. So the program, I will talk a little bit more about the individual components of the program later on, but roughly it consists of 3 parts: a taught component in years 1 and 2. You will work on a professional practice portfolio in year 3, and you'll work on your own research project from year 3 onwards through the end of the program in year 5. So so as this is a very international program, the emphasis is on distance learning, with during the first 2 years of the program, during the taught component of the program, every term you'll come to London for 1 week for a residential, where you meet other students, faculty, and other thought leaders. So yeah, coming to UCL, you're really joining one of the world's leading research communities. So we are the Times newspaper proclaimed UCL the 2023 University of the Year. We have an excellent performance record in research assessments, in various rankings. In the most recent research assessment exercise, which ranks UK universities based on their research performance, we are ranked second in the UK for research power and first in the UK for research power, specifically in the disciplines of medicine, health, and life sciences. We're consistently ranked among the top 10 universities in the world, most recently ranked 7th in the world for global health by the Shanghai rankings. And what you're really joining when you join UCL is and come to London for these residencies throughout the program. It's so you're connecting to one of the world's leading innovation ecosystems in the field of health and healthcare. We have leading research universities such as UCL, Imperial based here, as well as other smaller academic scientific institutions and medical research hospitals. We have many companies having R&D facilities in the Greater London area. And London has really a thriving biotech entrepreneurial, represents a really vibrant entrepreneurial ecosystem as well. So what makes a UCL DBA Health stand out? So what really makes our degree stand out? As I mentioned, we're the only business school in the world dedicated to health. So there's no business school that understands health better than we do. Sort of health is integral to everything we do throughout our research, education, knowledge exchange programs. Our programs have been specifically designed for aspiring healthcare leaders with really contemporary topics. So the emphasis is on these contemporary topics. So really, we will really bring the aim is in this research degree is to really bring you up to speed and a person who's actually able to engage with these debates that really define the health and healthcare sector at the moment. So our lecturers and research advisors are world leading in their field with a range of research interests. Once you graduate, you'll be able to access our executive education portfolio at significantly reduced rates for lifelong learning. And I think what's very valuable in this program, it's the networks and connections you make with fellow students in this program, and also with the thought leaders, the faculty you meet during these residentials that are such a critical part of the program. So what's the typical DBA health student profile? So what we're typically see is students who join the program with several years of experience, professional experience in the health and healthcare sector, with a very keen interest to gain an applied research background to really drive forward an evidence-based approach to thinking and innovation in their particular professional field. So these are typically more senior staff wanting to enhance, refresh their skills and knowledge in a particular field without taking a career break. And it's really a program focused on individuals who have either completed a master's degree or an MBA who are looking for the next academic challenge to make a difference to health and healthcare solutions. So what we're looking for is professionals looking to pivot into applied healthcare management research. So a little bit more about the program and what we provide. So we provide, really, this is a professional doctorate degree for individuals in health-related fields who want applied research skills to address health sector's challenges. So what we're looking for students who want to be thought leaders in their professional fields, but really who want to maintain, also after finishing the DBA, a strong connection and link to professional practice. So this is not a PhD degree. So if you want to pursue a research career and want to go onto the faculty track, the tenure track at university department, then it's better to do a PhD program. So again, this is an online, so this is a largely a program based on distance learning, but very importantly, during these first 2 years, we have these residentials during each term, where before the 5 weeks preceding the residential, you'll have around 5 weeks of asynchronous learning, where you're viewing online lectures, discussion panels, are engaging in assignments online, and this spirit of asynchronous learning leading into these residentials. So that's the first 2 years, and these first 2 years of taught courses really provide you opportunities to develop your skills and knowledge in key areas of business and health research methods to facilitate your further studies and your later career development. Then during year 3, you'll work on an advanced professional portfolio, which allows you to really reflect critically on practice within your organization and sector. And then the largest component of the program, it's the research component, where you actually work on your doctorate thesis and focus on the development of these skills in critical appraisal, as well as the ability to develop the rationale, methodology, and methods for the research. So we have 1 intake for this program per year, every September. And so the first intake, upcoming intake is in September 24. The duration of the program is 5 years, part-time, so this is based on distance learning with termly 1 week in-person education in London, once a term during the first 2 years of the program. So applications are currently open until sometime in June next year. And the costs for the program are the same for UK and overseas students. and currently stand at 64,500 pounds. So again, the structure of the program, I already elaborated a little bit on that. So the first part, the first 2 years, you'll do these taught courses. The second part consists of this professional practice portfolio. And during years 3 through 5, you'll work on your doctorate thesis. So you'll need during these final 3 years deliver your advanced professional portfolio. You have to submit your formal research proposal for ethics approval. And yeah, most of the work will go into actually doing the research, writing your final thesis, and have it accepted by the DBA committee. And then in the end, as a final task, you'll have to present and defend the thesis at a Viva examination. So there is the option for students who complete the taught component, but do not, for whatever reasons, wish to continue to work on the thesis. They can take an exit award of a postgraduate diploma in research skills for business administration in health. So what are we looking for in our admissions? So typically these are students with a master's or MBA degree, or other overseas equivalents, or there's the option of enrolling as a graduate without the relevant degree, but with extensive relevant work experience in the health, preferably in the health and healthcare sector. There are some important language requirements, and as I mentioned, you should already be in the health sector. So if your previous experience is from outside health, you should use your application to demonstrate a strong desire to pivot into the health sector. So applications for the program are open until the end of June 24. Most students will have around 5 or more years of professional experience. And as part of the application process, there will be interviews with myself and other faculty members. And we ask you to write a personal statement and provide 2 references that we may contact in the selection process. So yeah, just to give you an idea of, so the one of the key determinants of your experience as a doctorate thesis is, of course, a link to the supervisor you'll work with during years 3 through 5. And yeah, just to give you some example of the kind of supervisors who are doing research within our school and who are available to supervise DBA students and involve them in their research or supervise their own research. So we have 3 main research groups within the school. We have a group focusing on behavioral aspects and health economics, led by Professor Sotiris Vandoros. He's a professor of health economics with expertise who recently joined us from King's College London, as also a visiting professor at the Harvard School of Public Health. And he's really leading a cluster within our school focusing on questions related to behavioral economics, health economics, and the regulation and competition in pharmaceutical markets. So we have the director of the school, Professor Nora Colton. She is a professor of health leadership and management for healthcare. So she has extensive experience doing research on issues linked to leadership in healthcare, the political economy of health. She has particularly extensive experience working with health systems in the Middle East, and she's able to so she's supervising research on topic related to health policy, leadership, and innovation. Then in June this year, we were joined by Professor Kabir Sheikh. He's the professor of global health systems and policy, also heading the health systems cluster within the school. He joined us from WHO, where he worked on universal health coverage, and he has extensive he's various visiting appointments at the School of Tropical Medicine here in London, in India, and Australia as well. And he's he has an world-renowned researcher in the field of health systems governance and policy. And then there's me myself. I'm, as I mentioned, the professor of management and healthcare innovation. I really look at research questions on the intersection of innovation, health, and innovation and health systems. I have several projects I lead looking at R&D in the life sciences, and I am leading various projects in both in Europe, in Sub-Saharan Africa, and the US, looking at digital transformations for health. So we have researchers in operations, such as Dr. Rodolfo Catena in health economics, working with Sotiris, Sonia Tomini. We also have Professor Adam Duis, who's the Deputy Director of Research of the school, and who is head of our Digital Health and Entrepreneurship program, MSc program. And he's extensive experience in commercializing new health technologies and in the digital health space more generally. And then finally, another example is Professor Julie Davis. She's the director of the MBA program, and she's done extensive research on sort of human resource development in the healthcare sector and leadership. So we have these, we have several other open days planned for other programs we are offering in the some of these open days. They've already taken place, but if you keep an eye on our LinkedIn account, you'll find information on these on open days that we'll organize in the new year as well on these various programs. For your interest, probably most relevant are the MBA health program, which is also a professional degree, and the eMBA program, the executive MBA program, for which there will be a open day tomorrow, actually. And of course, we have a PhD program, which might be of interest. You'll find more information about this and more on our website. And please post your questions in the chat area of Zoom, or raise your hand, and then I can give the floor to you to ask your question. So I'm very much looking forward to sort of the questions that my presentation might have raised, and I'm more than happy to have a discussion about that. So I'll end the presentation now, and we're switching to the Zoom chat. So any questions? Yeah, I'll wait two more minutes, because sometimes it takes some time for students to write down the... so I'm looking at the wrong... so there is a... here. So I was looking, sorry, in the wrong place. Okay. So a question, first question. So the total number of compulsory in-person residential sessions required for the completion of the program. So there are in total 6 residential sessions during years 1 and 2. So every academic year at UCL has 3 terms. And each term we have 1 residency where all the students come together. So these residencies are really, really important. I cannot underestimate how important they are and how much they are valued by students, and really providing the opportunity to, this is a very international program, to for students to network and really to immerse themselves in the research environment at our school and the broader UCL environment, and make those critical connections that not only learn and engage with the research that's being conducted within our school, but also make connections that are going to be critical in the sort of the second part of the program, where you're working on your own research and where you also you need to find a supervisor with whom you're a good fit and a good match, where you have good chemistry, and where you'll be able to know whom to contact within the school if you run into problems. So yeah, so that's the answer to the first question. So are there any other questions? So no further questions? So yeah, so if there are no further questions, I would like to thank you for your interest in this program. I'm more than happy to, if questions do pop up later on, just drop me a line via email, and I'm more than happy to set up a one-on-one to discuss these programs and any issues you may have with you in person. So yeah, so again, thanks for your interest, and I wish you a good day and good luck with picking a program and that is a good fit for you. Goodbye.